Hi, I'm Dr. Nima at Eos Rejuvenation in beautiful Beverly Hills. I'd like to talk about a closed rhinoplasty versus open rhinoplasty. I've had clients come in asking, what the difference is and, why do you choose one approach versus another. And I just wanted to clarify some things for my clients and future prospective clients who are interested in getting a rhinoplasty surgery. Right now, there are two approaches to get inside the nose in order to fix it, to get a nose that you like. The first is a closed approach, which basically means there's no incisions outside the nose. All the incisions are done inside the nose, all the work is done underneath the skin and by feel, and afterwards you put a cast on. There's a little less healing time, maybe 1 to 2 weeks, and your nose is done. Typically, those procedures are relatively shorter. They take between 1 to 2 hours depending on the experience of the surgeon and what you need done. And that can be a very nice approach for people who want minor cosmetic changes to their nose. The open approach involves a tiny little incision that goes between the nostrils underneath the nose, and that allows full exposure of the nose so you can see exactly what's going on underneath the skin. You're looking for asymmetries, you're looking for things that you weren't expecting, and it just basically gives you a lot more visibility underneath the skin so you can really address what you need to address. Those surgeries take typically a little bit longer, anywhere from 3 to 4 hours, but the fact is you'll be asleep for either one, so for you it'll still feel like 5 minutes. Now, what are the advantages and disadvantages of each? A closed approach, pretty simple. The advantage is there's no external incision, you don't have to worry about it healing incorrectly, and you can go kind of about your way. There's also a little bit less downtime. Typically final results can take maybe 1 to 3 months depending on what you're doing, versus the open approach, which can take 6 to sometimes 12 months. And what are the disadvantages? Now, the disadvantages also depend on who you go ask. Most of my procedures are open, so I do have a natural bias towards the open rhinoplasty, and I do some of my cases closed. What I feel personally is you really can't do everything that you can in a closed rhinoplasty that you can in an open. There's no such thing as a free lunch, so if you're trading one thing, which is the incision, for something else, the drawback is you just really can't get underneath the skin, take a look at both sides of the tip, for example, or deal with extremely crooked noses as easily as you can with the open approach. Additionally, you just don't have as many tools to do what you need to do, because one, not only can you not see as well, but two, you don't have the room to maneuver to slip in cartilage grafts, for example, and have the space to see and get kind of two instruments inside the nose, where with an open approach you have a lot more visibility. So going to the open approach, which I think the reason why I probably use it more often is because I get a lot of complicated noses with lots of asymmetries. I like using the open approach because you can really see what's going on underneath the skin, especially with revision cases. Revision cases are much more difficult. There can be bulges and depressions which you don't exactly know what's going on, so really looking at them underneath the skin and getting a good idea is very, very important. Now, the open approach does take a little bit longer, but if you close the incision correctly, you won't see the scar at all. In fact, it should be a reasonable expectation that no one should know that you had a rhinoplasty, even if they look underneath your nose. The open approach does have a slightly longer healing time, but this is a nose you're going to have for the rest of your life. So whether you have a couple months of healing time versus 6 months of healing time is really not that big of a deal in the long run. The majority of the healing time, though, that immediate post-operative recovery, is usually about 2 weeks for both. So I wouldn't say there's additional recovery time that's immediate and noticeable with the open approach, but the longer term, like having the tip definition coming in, all the swelling settle in, just takes a little bit longer with the open approach. So let me break it down in more simpler terms. What kind of patient or client would be great with a closed rhinoplasty? If you kind of have like a little tiny bump and maybe just a little bit of tip narrowing, but the rest of it looks okay, the closed approach is perfectly fine. If you're a person who has more significant issues, maybe the nose is really wide, maybe the nose is really crooked, maybe the tip is asymmetric. You can also tell if you have asymmetries if you have a good side and a bad side. So a lot of my clients come in, they're like, oh, I really like my left side better than my right. That usually means they're asymmetries on frontal view. And in those people, an open approach, I feel, is a lot more comprehensive to give you a result that you're going to love. Remember, A natural looking rhinoplasty is all about the details. It has so many little details from what it looks like from the front to the bottom and even the side, and as it even comes down underneath. And if any of these issues are off or these details are off, it's a telltale sign of having surgery. So I think when it comes to having your surgery done, the method of how you do it is not as important as really what the result is, and that's what you should focus on.